Hey, my medical coding family, how's everybody doing? Can you guys hear me today? Hey, Miracle Mom, good to see you. Hey, Janelle. Hey, Go Kart. Hey, Stacy. I did self-study for all my certifications. Somebody asked in chat, do you think it's better to self-study than go to a university? You know, employers won't care one way or another if you have a degree or not. They just want and must have that you're certified. But other than that, you know, you can self study all you want. How I did it. Can you guys hear me on YouTube? I was just making sure you guys can hear me fine. You can see the screen. Let me know in chat. Hey, Preet, how's it going? We're doing a free workshop today. We're going to do 75 questions. It's low. We're going to do 75 questions in the same pace as the certification exam. All right. What sections in the CPT book, if needed, should I make last minute notes? I'm doing DEF, practice exams, and study guide. Be sure to know when you can do consultations, when you can do admit and discharge all in one day, same code, like those 99234 codes. Those are the most important definitions. Other than that, practice as many practice questions as you guys can find. There is a better screen view of this, I'm sure, on Tube of the U if you guys are on TikTok, but we're going to do a whole bunch of practice questions. Hope you guys have your ICD-10 and your CPT book ready so that we can get started. Yes, this will help for the CCS. One of the very first people that I ever helped pass the certification exam was Janet back in 2019, and she did the CCS. Absolutely. Happy Sunday. Happy, happy, happy. Hmm. The main thing is to look at your headers before your descriptors, that's for sure. Be sure you've gone to AAPC's website. You've checked out this tutorial video that they have. If you go to AAPC Marketing, this S3, where it's got the online exam requirements and instructions, right here, there's the website. If you go to this page on their website, they do have a PDF that you get to download that'll tell you what books to bring, what items are allowed to have on your desk or at a testing center. These are PDFs that you get to download, which are great. Then the other part that they have is right here on the side here. They have all these drop down menus, and each one of these is a navigational bar. And you get to watch a ton of videos inside all of these little side notes right here. And they are extremely thorough. They will show you how to show off your driver's license. Where do you put in your AAPC membership ID number? Um, how do you shake up your books or show them off? Even if you're doing it in person or at a testing center, they go into great detail and show you all kinds of information. Um, and photographs of exactly what your desk should look like. So this is really helpful. You can click on this note tab right here too, which will show you where the PDFs are that you get to download that go along with it. So it's really handy dandy. Some things for you to remember about this certification exam is that it is already coded for you. The purpose of this is not to prove that you're a very good medical coder, right? Because the exam is already coded for you. If the point of the exam was to see if you were a good medical coder, then they would give you charts and give you time to code them, right? They're only giving you 120 seconds per question to pick out a correct answer. So the purpose of this is to see if you can manage your emotions, keep things under control, and if you know how to navigate the books, right? If you are a good medical multiple choice question answerer, then you can pass this exam. It's already coded. You just need to pick out the correct answer. You're only responsible for the available answers for each question. Run to those answers first. I swear, please do not read the questions, okay? Go straight to the available answers. Look for similarities in the available answers. And then if answer A is correct, think about what you will see in the exam question that makes that answer correct, right? You'll have different answers. And if it's answer A, you'll see you did epi. You went around a certain area. If it's answer B, it might be trans. You went through something, right? Answer C might be an open procedure. Answer D might be a closed procedure. It's more of a broad overview of how the book or manuals are to be utilized is the purpose of this exam. If you know and understand how to navigate the books, then you'll do just fine. Be sure you've gone to the inside of each manual has instructions for how to use the manual. Even in your ICD-10 book, even in your CPT book, they have these instructions of how to use the book and the list of the features that are included in the manual. Those will be some of the very first questions you guys will see is the features of the book. How do you use them? How do you navigate throughout them? What does it mean when we have an indentation here or a parentheses here or a semicolon here? Be very careful about the wording of the questions. They love to ask questions about which example below is not correct, so that you're looking for an incorrect answer. And about halfway through looking at the available answers, you'll forget that you're looking for an incorrect answer. So be careful. Stay focused and have a plan of attack for each section. What I'm talking about is like for E&M, I don't do process of elimination. I only look for similarities. If I have two available answers that are admit hospital and their only difference is whether they're low or high, more than likely my answer is one of those admits. They're just asking if I know the difference between low and high. If I'm doing anything from anesthesia all the way back to medicine, then I do the process of elimination and also look for similarities. If it's cardiovascular, I know I'm looking for things like, am I doing procedures on the right side of the heart, the left side of the heart, or combo? If I'm doing integumentary, then I know I need to know Am I cutting into the body? Am I using scopes to get into the body? Um, those kinds of things. You need to have a plan of attack. What are you looking for the differences between your available answers? Here's some additional homework for you guys, too. Some prior exam areas are super helpful to make sure you know the differences of. Be sure you know what's going on in your 14,000 code section, right? What's the difference between repairs when you have simple or intermediate repairs? What if you're destroying a bunch of lesions? What does that mean? Um, Anatomy wise, what connects things to other things? Um, what's the differences between injecting or destroying or even the subcutaneous levels, right? What if I'm surface, muscle, or down to bone? Those things make a difference. Different types of tumors, different vocabulary words for similar things like OS or itching or different infections, um, dry needling versus acupuncture, those kind of things. Um, what makes up a joint, like the ankle, the shoulder, or the knee, those kind of things are helpful. Um, when you're doing procedures inside a joint, what words will you see in certain examples? What if you have delayed procedures due to expanders or this, that, and the other thing? What if your parentheticals happen to be underneath different codes associated with some codes? That can be helpful. Sometimes your procedures don't require physicians, sometimes it's just staff, like any telemedicine visits in the front of your CPT book all require MD to be present, right? The telemedicines in the back of the book in the medicine section are for like caseworkers and social workers and stuff like that. Super helpful to know those differences. Remember that you can't code things that are already included in certain things. You know, like a biopsy is already included in your excision. If you're going to cut something off of somebody, biopsying it is already included. Don't double bill. Or if you're billing an office visit with a procedure, remember that the amount of time it took to do the procedure cannot be included in your E&M visit for that day, right? You can't double bill the time it took to do the procedure, but you're also billing that procedure code. But then you're also counting all that time to do the procedure in your E&M visit. Can't do that. So be careful about that. One other thing about E&M is if a patient comes back to review lab results, right, that you ordered on a previous visit, you cannot count that as today's E&M review, right? Because the day you ordered the test, like a CBC or a chest x-ray, you would have counted that towards that office visit for ordering data, correct? Now, the day they come back for you to give them results, you can't double bill that. You can't bill it again and count it towards MDM. You already counted it for the previous visit. You can go over the results and tell them the results, but you can't count that as today's part of MDM since you already counted it the day you ordered it. Those kind of things are helpful to know during your CPC exam. Here's one of our very first questions that I love to go over. It's one of the questions I wrote for review. What do you guys think is the answer? Yeah, we'll go over some scenarios. Let's do some of these practice exam questions. Sequencing, don't worry about it so much on the CPC exam because all the answers are going to be done for you, right? They're going to be sequenced for you. There is a correct answer in front of you, and it will be sequenced correctly, right? If you know how to navigate your book, then you will be able to answer those questions right away. Type in chat what you guys think is the correct answer. Yeah, we'll do at least 3 hours today. Lynn, thanks for joining the a member of the YouTube club. Now you've got access to all of my book prep videos. You're still finishing? Ah, yes. Well, this is super cool because in your HipPix book, you have every single one of your modifiers. You know, there's quite a few inside your CPT book, but inside your HipPix book, if you happen to have AAPC's version of the HipPix book, you'll have a front cover that will list everything from AA all the way to the last modifier. Well, there'll be a bunch of them, like, you know, and if you're going to look for, sorry, I was trying to do this, RH, right? And you go through these in alphabetical order looking for RH. We've got RT right here and RS or HR, but looking for an RS, there is an RC, an RD, an RE, an RI, and an RR. So if you're looking through even the front covers where they have a small description of all the modifiers, or if you go to your Appendix B, I think it is, Appendix B, that has a list of all your modifiers from A1 with the full description all the way to the end, right? That has through XU, you won't find RH. There's no modifier with that acronym there at all, right? And that's because to find this particular modifier, you have to make and create that modifier yourself. And to find it means that you know how to navigate your HipPix book, right? Which has a special chart in it that unless you've utilized it before, you wouldn't know it was there, right? So if you go to your very first HipPix code, which is A0021, right before it, you've got this tiny little transportation chart here that has a list of one letter modifiers, D through X. And these are site locations of where ambulances pick up patients and then drop them off somewhere. So you would create your own modifier depending on where you picked up the patient. Usually for the CPC exam, it's like a site of an accident, right? Or scene of an accident, right? And then they take them to the hospital. So normally your modifier is SH. But for this one, I did RH where they were at their maybe residence, and then we took them to the hospital, whatever. But you create your own modifier. And you would not know that this modifier is here unless you knew that this chart was here. You wouldn't know that if you hadn't gone through the very beginning of your HipPix book and read the instructions for how to utilize the book and how it is set up. So I highly recommend all 3 manuals. Go look for your instructions for how to use the book, They'll tell you how it's set up. They'll also let you know about the different types of codes and the way they're set up in this book. This page right here in particular is often on the exam where they talk about notable codes like the C codes, the G codes, the Q codes, and the K codes. There's an exam question usually on this page right there. Miscellaneous codes, dates of when things are put into law, or who controls and who wrote and who updates the codes. And then one of the last things you need to know is when are codes updated. HCPCS are updated quarterly, but some of the codes inside here are only updated twice a year, and some of them are only updated once a year. So it depends on which type of codes they're talking about. So when they ask you on the certification exam, they may trick you and you might assume you know that they update quarterly, but they might be asking you something about them updating annually. And there is different dates, like when the codes are released versus when they go into effect. Those have different dates also. So just knowing how to navigate this book is really helpful. Let me get this back out of the way. And yes, RH is the correct answer. And then I just have a little screenshot of that little HCPCS chart that's near your first set of HCPCS codes. If you know how to navigate your guidelines for this question, you would be in section 4, somewhere around in here, right? M says patients receiving preoperative evaluations only. See figure VIM on page 36. We go to page 36. G36. Patients receiving preoperative visits. What diagnosis code do they need to go with it, right? We got Z01.81 listed, right? So we know right away 2 answers we get rid of. So what I like to do is, I know by looking up the guideline, I get rid of this one and I get rid of this one. Then I look for my differences and similarities, right? The I-10 is the same in every, answer, no matter what the answer is. The only difference is our our K code. Are we a 21 or a 20? And since it's 20 in 3 of the answers, and only one answer has it different with the 21, I know that my answer is going to be C. I probably wouldn't go look at my differences between the K80.21 and the 20. I would just use the process of looking for similarities, pick the C, and move on to my next question. But totally up to you guys, what you want to do. But I would look up the one guideline and move on. Then look for my similarities. And C is our answer. Let me move this out of the way. Go. Non-essential modifiers. So I know they're looking for our punctuation, which is 0.7 in our guidelines, which is on page G3. We go to G3. Look for the word of non-essential modifiers. That guideline was at section 4 under diagnostic coding and reporting guidelines for outpatient services. You go down to M. This is patients receiving preoperative evaluations only, which is on G36. Knowing how to navigate these books is vital. What do you guys think? Where does it say non-essential modifiers? Right here at the bottom of point 7, under punctuation, underneath brackets and parentheses. About 3 sentences down, it says the terms within the parentheses are referred to as non-essential modifiers. Non-essential modifiers in the alphabetical index apply to any subterm, blah, blah, blah. B, correct? Wordy ones, wordy ones. Chemotherapy, radiation, outpatient services. So we'll go back to our guidelines for outpatient services. Which one will go first? For therapeutic services, that's letter letter L. Therapeutic services, still on page G36. Letter L, therapeutic services. Indeed, B is our correct answer. Good job. Good job. Perfect. Remember, they love to ask which one is not correct on the exam. So don't forget as you're going through these available answers, which one is not correct. Or not medically necessary. Correct. It is B. Perfect. Good job. Move this camera view out of the way a little bit more. There we go. How many codes are assigned to the diagnosis of acute respiratory failure due to sepsis pneumonia? You know how to find that guideline really quickly, right? We've got a condition that is specific. So we'll be on the very first page of G1. We'll go to chapter specific guidelines, right? Sepsis is D. That tells you to go to G8. This page right here tells you what the answer is, right? I'm on G8 in your ICD-10 book right here. Sure, we're doing 75 questions right now in the same pace as the certification exam. Can you do and answer these with your manuals with me right now? If you can get 90% of them correct, then you know you're ready for the exam. If not, just practice a ton of practice questions between now and then. Miracle, what does this page say? Look, you have a decision tree here too, right? We have organ failure, right? Respiratory failure. Organ failure means we have how many diagnosis codes? 1, 2, 3, right? No organ failure, you have 1, 2. They just want to know, can you run here? And do you know that respiratory failure means that an organ is failing, right? Lungs are stopping. Oops, sorry, I grabbed the wrong one. Three. Get a piece of paper, Janelle, beside your desk and just check put one line down when you get one right. And then every 5 that you get right, you get to do like a 1, 2, 3, 4, and then 5, and then you can keep a tickler going. I have a total of 91 questions, but I don't know if we'll get to all of them, but we'll try. Trying to do at least 75, but we'll see. All right. What about this one? Drug dependency. What I see right away is my endings, right? A, D, and S. And I know sequela is usually this, D is usually subsequent. So this is probably initial visit, right? We just seeing this person for their initial withdrawal symptoms. So I know the ending of whatever's going on can't be the S or the D. Just knowing that tiny little fact about those 7th characters can get you down to, these 2 answers right away, right? And then again, I look for my similarities. Because I have two answers that end in the 23, I would just pick C and move on to my next question, right? Just in general, you have 3 of those last digits. Now, fractures, of course, you could have A through Z. There's a lot of different endings. But as long as we're not dealing with a fracture, you're usually just dealing with initial, subsequent, or sequela visit. And those are easy to deal with, right? I wanted to say thank you for the tips on your videos. It really helped me a lot on my exam. I passed on December 16th. Yay! Congratulations. Yay. It was your third attempt. Congratulations. I'm so proud of you. That is awesome. Awesome to hear. I made a little difference in your life and made it a little easier for you for sure. The great Christmas present. Now you don't have to worry. You got all the holidays to relax and, not worry about things. And congratulations. So proud of you. That's awesome. Wellness exam. We've got inoculations and vaccinations on page G29. What would be our diagnosis codes, right? And even just knowing, like, if I go to B, I go to the B section right here in my ICD-10 book, what does the sidebar say? It says that the patient has certain infections and parasitic diseases, right? If I'm going to give them a B diagnosis code. Did we just give that kid a diagnosis of hepatitis, Hib, chickenpox, and mumps, measles, and rubella? Do they have those diagnosis codes? Is the kid infected with that disease? No. They're just here for wellness. So we just do C. Remember, don't use those codes unless the patient has that diagnosis. And giving them vaccines to inoculate against those diseases does not give them the disease. I like to use in my CPT book our anatomy picture that we've got in the front of Integumentary right here, or thinking about what's in our epidermis or hypodermis or dermis or sebaceous area. What do you guys think is the answer for this one? It is not A. Try again, Tilly. Indeed, hypodermis. That is C. Integumentary. Love it, love it, love it. So the first thing that I notice is that this 401 is in 3 of my answers. What's going on in this 11401 area? That's an excision. If we look at our headers for the other sets of codes, so our 114s are for benign lesions, right? Our 120s would be repairs for intermediate. Our 131s are repairs that are complex. Did we have a repair and an excision that we both can bill at the same time, or just one or the other? Indeed. We've got layered closures and we've got excisions, right? Nothing that says that we did debridement or that would bump this up into something more complex, right? If we just stayed in our intermediate with our layered, yep, we'll definitely do our C. Yep. Or B. I'm sorry, B. Not C. C had R complex. Yeah, I'm sitting here saying not RC because we did not move it up to a complex, right? Because we didn't have debridement or cleaning out the wound. We stayed in our layered closure area. Yeah. Sorry. Get dyslexic after a time with these numbers too. Gotta be careful. You mean to pick C or pick B, but you pick C. Some of those answers are crazy. All right. We've got this one, and I see that we have the O3 in 3 of the answers. So if I look at the 17,000 codes, right? What's going on in this section? That means we would have destroyed up to 14 lesions if we were dealing with that. How many did we destroy? We had more than that, right? So I know I could not bill that code at all because the O3 only deals up to the 14th lesion. We had 16. So anything with the O3 in it, I cannot bill. So I know my answer right away with this one would have to be D. Yep. All day long with that one. All right, what do I notice in this one? I've got a ton of B, C, and D all have the same here, right? It's just knowing whether you can add 51 or you times. What's going on in that 11201 area, right? What can you do with those codes? Do you times them? Do you add modifiers to them? What's going on? What type of code is 11201? 11201. That's an add-on code. We don't add modifiers to those codes, so we have to get rid of B right away. How many did we have? Because if it's C, we did 5. If we did D, we did 6, right? So somewhere around there or something like that. We got 15 lesions, plus 10 more, so a whole lot more, So our beginning number, this one deals with 15. And then each time we do this, we would have had 10 more. So either we have 40 more or we have 50 more. So how many did we have altogether? We have 16, 16, 17, and 10. I can shrink this to make this fit a little better, probably. Hit this. There we go. How many we'd end up with? We ended up with like 59, right? Because this is 36, 46, plus 17 more is like 59, almost 60. Yeah. So we know which answer is going to be correct. Practice. You've got to practice. I always get confused on what I'm actually coding for each scenario. Is there a way to know? Practice. Looking at the code descriptors inside the CPT book and noticing the last words, usually at the end, right? This says including 15 lesions for my 11200. And then my 11201 says each additional 10. So I know that my first 15 are covered here. And then each 10 is with the add-on code. Add-on codes, no modifiers. Get rid of that. Then I just need to know how many altogether that we did. Yes, D is the answer I would pick also. Good job. Perfect. Do you know your definitions of fancy terms? Do you know which one of these destroys will do that type of treatment? What are these types of lesions? Because some of them go under, let me get over there to those pages real quick. Some of them only do proliferative lesions, right? Some of them do chemical cauterizations. Some of them might do only laser and vasculars. Some of them might do chemical or cryo or laser, but they're pre-malignant conditions. Do you know those names? They do have a list of names, like on page 113 of your CPT book under the word destruction in your guidelines. They do list like a ton of different little lesions and their vocabulary terms. Everything from warts to port wine stains, those kinds of things. Do you know where they get coded and what they're under? This particular item is a vascular lesion. So we know answer C is pre-malignant, and that's like not vascular lesions, right? So we would not do C. Our B is maybe 106, maybe. How many square centimeters, and then how many did we do? One on each cheek, and each of them are 2. Yes, A is going to be your answer. Less than 10 squares. By laser technique. Muscular skeletal. All right, what do I notice about these? My medicine section codes strike me as interesting. For sure, pretty interesting right there. We also have 2 that are the same right there. What's going on with those codes? 2 7. open? Is that an open treatment? I don't think we did. Did we do open treatment? I don't think we did. We didn't do open treatment. This right here is open. And we didn't cut open nobody. So I don't like those. So our looking for similarities definitely won't get us the right answer on this one. What's our O2 is a closed treatment. Great. And our OO is closed. Great. What's our differences? It depends on the fracture, right? One of them includes with manipulation, one of them without. And if we're consciously sedating them, then you know we're manipulating them because there's no reason to sedate them if you're not manipulating them or putting the bone back into place. So A would be crazy. So has to be B. Remember, you got 120 seconds. You got to have a plan of attack. As soon as you see the answers, time's ticking. Tick, tick, tick. I see 2 of them that are 40. What's going on with that code? 246. Closed treatment. Is that what we did? Yeah, all we did was reduce. We wouldn't have opened up an elbow. It also is for the nursemaid's elbow, which is exactly what we did. So we probably are a 40. Then it's just a diagnosis code that we have to deal with, right? If I avoid R9s, so just a little trick that I do with diagnosis codes, my only differences between A and C, since they're the same diagnosis or procedure code, since I've eliminated the other procedures, is just these S's, right? And one of them has a 9 in it. Also, if you know anything about right and left, you know that your diagnosis code will have a 2 in it because you're doing the left arm. Right arms have a 1, and legs, whatever, left will have a number 2 in it. Just knowing that quick little fact will get you down to answer A, and you can pick that and move on to your next question. You need to be this quick at making decisions. And it's just based off of an overview of little things like that any coder could be able to do quickly, right? So we've got 2 answers here that are the 55. Those are my 2 similars. So I would look at those, that code real quick, 260, just to see what's going on in it. Make sure I'm under the right thing. 26055 is what? That's a tendon incision for a trigger. Yep. Is that what we did today? We did a tendon. Yep. We did an incision. Yep. So probably. Then it's just a matter of modifiers, right? Because you've got the same code for the 55 and the procedure. The only difference is the modifier. Would we add a 51 modifier or 76 to this particular patient? Our 76 is a repeat and 51 is an additional multiple procedures. What kind of code is 20610? If we look at our code, our second code, 20610, That is a scope in a joint. Good job, guys. Good job. Yes. Additional procedure. This procedure 20610 is its own parent code, right? It's it's not a child, it's not an add-on code. It's its own code. And knowing that to add the 20610 and the 26055 together because they're both their own standalone codes and independent procedures, what modifier would you use with those? And that's all. With this one, of course, I see that 29 is listed 3 times. 2 of the times it's got radiology added to it. So what I would do is, hold on, I gotta do the little puzzle piece on TikTok. Okay. I have to make sure that procedure doesn't already include radiology. So if I go to 316 real quick, 31629, that is a child code. You can't do anything with it, meaning it is indented far over, right? Where is its mama code? Its mama code is 31622. Does she include any radiology? Number one technique they're going to test you on the exam is to know whether or what parent codes have inside their codes that go along with other procedure codes, right? Go cart, look at that again, child. Look at that again. What is the right after the word rigid and flexible? What does it say? It says including fluoroscope guidance when performed, diagnostic, cell washing, and all. It says fluoroscope is included. What kind of radiology did you do? You did fluoroscope. Would you add and double bill fluoroscope for this procedure? Sometimes the word fluoroscope is one of the last words in the descriptor, and sometimes it's in the first part of the descriptor. Knowing those differences is super helpful. And you can quickly get rid of answers like that by just eliminating the radiology. You looked for your similarities. You got rid of C just because it was different. Kept these and got rid of the 2 with the radiology just because it's already included. And then you already know your answer has to be A. The only thing we got similar is some of the diagnoses right here, but all the procedures are like all over the place. So what I would use is the front of my book, this chapter. So what is 321? 321 is under what header and body part? 321. That's under lungs and pleural, and it's under incisions. That's answer A. 324 is under removals, which is answer B. And I'm using, in case you people on TikTok can't see, just this page on page 214 to look up my differences between answers A, B, and C. Instead of running to each code and looking it up individually, I'm looking on this chart to see what surgery it is under. So answer A is under incision. Answer B is under removal. Answer C, 25, is also under removal. And 216 is under a different body part, which is trachea and stuff, or larynx or something. What did we remove? We removed a lung. So we know we can't be whatever this is because that's under a different body part. These are all under lungs. We didn't just cut into it, right? What did we do? We did a resection of a lung. Yeah. So we didn't just cut into it. So it's one of these two, right? That gets us down to those two answers. Then you can just look at those two differences between those two codes. So 324. 84. It's a child code. You can't do anything with it. You got to go look at its mama, which is number 80. And then 32503. You see your differences? One of them is the removal of a tumor, and one of them is a removal of a segment. We did not remove a tumor, so it cannot be C, right? We removed a segment. I don't think anybody got that one right. Oh, a couple of them did on TikTok, but YouTube's struggling on that one. Yep. Let me go see what madness is going on in my living room. I'll be right back. You guys work on this one. Ooh, Travis on the phone with them cheerleaders. Whew. All right. Every one of these codes is down here twice. We got the O2, the O2, we got the O1, the O1, And we got the O5 and the O5. So they're like all on here. So what's the differences between these? What's going on with these codes? 369. Ooh, my notes in this area are all over. Let's see. We got Don't forget to just look at the top part of your pages for your differences. Don't look your eyes up and down looking for the codes that you're looking for. If you stick to the top, it'll get you there faster, although I'm super slow. All right, so our 6901 is needle with contrast and radio. Our O2 is balloon and stretching. And then our O5 is making a pathway through. This will be interesting. Plus, its mama is the O4, so you got to make sure you're doing whatever is going on with mama if you're doing the O5. What did we do today? If we did O5, we would have gone through the skin. If we did O1 or O2, we went through a catheter, right? What is a PTA? June. What does PTA stand for? Yep. Percutaneous transluminal angioplasty is what that acronym stands for. So when exam questions are using acronyms, knowing what that stands for is super helpful. They do have a list of these and definitions inside your CPT book. Also, your HitPix book has like Appendix C. It has a full list of a bunch of acronyms too. Plus, the back cover of your CPT book does too. But yep, it says it is an angioplasty. So just knowing those acronyms, because they love to use them on the exam. You have a set that's extra too inside your lab and path around page 620. That's another list of acronyms that might be utilized on the exam. And they love to do that. Not tell you the name of the procedure, but give you an acronym. Then you got to know that that's what that is. Yeah. Lots practice, lots of practice. Also, inside your CPT code descriptors, a lot of times, right? I like to go through there and put the acronym down next to it, right beside the CPT code. That makes it helpful. All right. Are we doing, ooh, what are these? What are these? What are these? 372 or 35? What are these? I'm assuming our answer is going to be A or D because those are the two similars, but I'm just curious what procedures those are in the thousands. 3 5s. Being cardiovascular. Three 500. That is a ruptured aneurysm under arteries and veins if we're answer C, and then answer B. Seven two three six would be a endovascular revascularization, open percutaneous or transcatheter revascularization. What did we do? We just placed an extra vertebral artery. So that's not in cardiovascular at all. Yeah. We just need to know if we need to add the 26 to it or not. Yeah, it does say PTA in a different way. Yep. No worries, Maria. I'll see you guys later. Thanks for the heart me on TikTok. Thank you for the 26 roses. Thank you for sharing and liking live. Appreciate you guys. Yes, it does say only for the supervision and interpretation. So D is correct. Yep, perfect. This one's probably 2 pages, right? Yeah. So what's our differences between our available answers? If I just look at the first code, the 232323202. Ooh, I've used up these pages so much. We have insertion of epi. If I do 33206, we are doing insertion of transvenous. If I do 33224, and I only know that because I got my codes prepped ahead of time. 33224, this one is left venous. And then 33216, 3216 is, where are you at? Transvenous 2. What did we do? We did epi. And the only one that I said was epi was A. The rest of all these, the 06, the 24, and the 16, yeah, those are trans. Epi is what we did for that. And then our 24, is that our second code? 24 was venous left, previously placed pacemaker. And yes, this patient had a previous, yeah. That's pretty good for your CCA. Yes, A is our answer for this one. Perfect. Just having those highlighted. So, for example, 33203, I have epi highlighted. 302, I have endo highlighted. The words temporary, permanent highlighted. In like 33211, I have the word trans highlighted, right? Knowing whether you're trans, epi, intra, extra, where's your lead going? Around the heart, through the heart. That is one of the most important things. And also this lovely chart that we've got on 248. If your available answer is not on these pages as a correct answer, then it's not correct. One little hint here, like you won't find like some of these put together as a correct answer, but you will find, those two put together as a correct answer. So that will help you out too, as long as you can look at that chart quickly and determine things, but it just takes practice. Modifiers. Some modifiers are on the front cover of your CPT book. Don't forget, not everything is listed here. You may have more modifiers that you need to know or have to refer to, which are all listed in your HitPix book. But most of them are right here. Are we doing 58, 78, 79, or 76? A question just like this definitely will be on your exam. Indeed, B is correct. Good job. I hope you guys have a great holiday. This is my little holiday gift for you guys. This free workshop, free access to 75 questions done in like 3 hours, just like you will face on the certification exam. The replay will be available on Tube of the U, so you can watch it in your own time whenever you get a chance. I also have last year's December's, last year's April's too workshop, because I give one away also every April for my birthday. So hopefully this is just super helpful for you guys, that I do 2 of them free every year, and those replays are still available. And I've done at least 6 years of this. So you've got a dozen workshops with at least 75 questions or more, all available to you on Tube of the U, that you guys can watch, that are completely free. And you can pause the screen, fast forward the screen, but I highly, highly, highly encourage you guys to do them in like double speed, because like increase the speed, or really truly set a timer where you only give yourself 120 seconds per question. You got to have a plan. How am I going to handle these questions, right? First thing that I see is 2 answers start off with the same one, right? And then I've got 2 that are these codes. So, having the plan of attack to see which code set is under the correct header is super helpful. Utilizing any charts that are in your CPT book around these codes will be vital for sure. Any coding tips that are on or in your CPT book, any of them that say the coding tip, that will definitely be on your exam, and any charts that are listed or decision trees will definitely be on your exam. Don't ignore these. Don't hyperfixate on just the code and the descriptor. Code and the descriptor. Be sure to know how to navigate and utilize the information that is given freely in the book or any coding tips. Anything that says coding tips, that's where they get a lot of their questions from. If we look at the beginning of our chapters, right, this page in our digestive system, right, the 3, 2, 4, 5 is under what? Endogastroduodenal scope, right? Our 5378 is under what? Five, 3, 7, 8 is under the colon and rectum, under endoscopy. Diagnostic, colonoscopy, to the cecum, beyond the spectrum, but not to the cecum. To the cecum tells you that the answer is that one purple box right there. It tells you what your second code is. And you only have one available answer with that second code right there. Oops, I moved the wrong one out of the way. Sorry, guys. Just trying to move my camera out of the way. I have to grab it. It says I grab it and then it doesn't grab it. It's silly. All right. There we go. 424. 424. The answers are already sequenced for you. You don't have to worry about that. But I mean, as far as this answer the question, you do it the way the question asks. What's first is your EGD, and then your second one is your colonoscopy. They're sequenced the way they say them in the exam question. I've never seen AAPC mention anything second that they wanted first in their exam questions. They're not that diabolical. I would be, but they're not. 424. 10. That's an excision. 15 is also an excision. 20 is a total excision. And 30 is under incision. These are under excisions. What did we do today? Did we just cut into the body or did we remove something? We did ectomy, right? We got lateral, and this one's got lateral with nerves, and then this one's got a total with preservation of the nerve. The 15 and the 20 both have the preservation of the nerve. It's just a difference between whether you did a total or lateral. And we did lateral, so you know your answer is going to be B. Yep. Some of the questions I write, some of the questions are from everywhere under the sun, whether it, pocket prep, CCS, CPC. I do have the license as an instructor from AAPC, so they do come from all over. If we're doing this one, we've got the 74 down twice. Would I need an extra code? I'd probably just pick B with this question and move on to my next question because I love looking for similarities. And then knowing whether it's one code versus two, they're probably just going to try to make me think that I have to build two codes, right? So I would probably just pick B and move on to my next question, but we can go look up the codes if you guys must. We go look up 43274. That's a child code. You can't do anything with it. You got to go see Mama. Who's Mama? Mama is 43260. What does she include? She is a ERCP diagnostic, including collecting specimens, brushing, and washing, right? What did we do today? We did our ERCP and we placed a stent. What would we bill? I still say we'd only bill the B. But we're going to bill both? No way. Let's see. What is 74? 73. I would so get it wrong. What is that one? I didn't even look it up. 3273. What is it? Is it add-on code somewhere? Oh, yeah, it's the Endocope. Down here for the papilla, direct visual. If we get to look at the pancreas or yeah, we get to add on the add-on code. Ooh, yeah, I would have so gotten that one wrong, but that's okay. 1 out of, 50 so far is pretty good. How many have we done so far? Not too bad, but I definitely would have gotten that one wrong because I would not have billed 2 codes over 1, but that one is correct. You do get to add on that add-on code if you do go and visual examination of that area. So they do get to add on that other one. Yeah, I so would get that one wrong. And I probably will continue to get that wrong forever. There's just no way I would build two codes over one. More often than not, it's always just the one code. Too fun. All right, what about this one? Which one describes a violation of HIPAA? A is a violation. And like, I don't take verbals. You go write your order in a chart somewhere, Mr. or Mrs. But technically, the one that they're looking for is definitely C, right? Yeah. Can't do anything within earshot. Ooh, don't forget about your business of medicine. We would need to know what is going on in the different parts of Medicare as if we were a biller, even though technically we're only supposed to be medical coders, right? But where would we bill for services for hospice? What does that fall under? And I like to just add those to the front of my book in my CPT book. That way I've got them listed and I don't have to think. I can just run to my list of what's covered with Medicare Part A, B, C, or D, and I can just gauge it right here. Yes, Medicare Part A. One more time. What about this one? What about that colonoscopy we just billed? Where would that fall under? A, B, C, or D? B. It's correct. Good job. Don't forget they also do like therapists, home health care services. I think something like that is asked on the exam. Just be sure you know everything that might be under B. All right. This is one that I wrote for you guys. Just looking at the code and its modifier, which one would be correct? What can you code? Or incorrect, I mean. Which one is incorrect, not correct? Because we know our P1 status could go with anesthesia, right? If your patient is healthy. So that's probably okay. What about a 26 could probably go with an x-ray because if it's physician doesn't work there, but they're reading the result, maybe it could go with radiology. So which one would be incorrect? Wonder if there's a right and a left there, or what do you guys think? What about on TikTok? Which one is incorrect? Since I have a few of you guys on, I'm going to give away um, 5 memberships to the YouTube channel by giving them away in chat. There you go, guys. So I just sent them YouTube some money, and it will pick out some winners of the YouTube contest. We got Cuba, Ash, Tracy, Michelle, and Allie. Yay, guys. So you guys have access to all of my book prep videos. Don't worry about the year that they were done. I've got, the codes don't change. You might add some new codes to a section, but if I'm doing Lab and Path from 2 years ago, go write down what I wrote down in that Lab and Path section, because that's awesome, right? It's free YouTube videos where I'm doing book prep, and it's great. Don't worry about the year. Also, I have ICD-10 and guidelines. I have podcasts that you guys can read or listen to. Just let them play while you're doing laundry. There's all the workshops, every one of them that are older than 90 days. You've got access to 6 years of all the workshops. So those are all, 75 to 100 practice questions, all in one folder that you guys get to watch and practice questions. Great way to access all those questions, especially only for 5 months. So you guys get access for the next 30 days for free. Yay! Yes, everybody got this one right. B is correct. So just knowing what codes you could add modifiers to legitimately is a skill for the certification exam and will help you guys pass it. A lot of times, just by knowing you can't add a modifier to a certain type of code, that is really helpful skill to learn for the exam. All right. What about this anesthesia question? Are we a 36 or a 34? First, figure that out. They're both lower abdomen. One of them is NOS, and the other one is about a gestational birth. Like how old was the kid when they were born? Or how long of a gestation did they have? Anybody on TikTok wants to hop over to Tube of the U, I will be giving away 5 more YouTube memberships. So if you just want to view this little workshop on your device, just being in that chat room will put you in for the contest. Close lifestyle. Try again. This question does not say anything about a child's gestational age, right? So we know we're not a 36. So they are a 34. And since their age is listed inside the CPT code descriptor for anesthesia, we know we do not need to add the qualifying circumstance code, which is on page 69 at the top, for a patient of extreme age. If they are less than 1 year of age or older than 70, normally we do add the 99-100 code, but because it is listed in the descriptor of 834, we don't have to for this patient. Yep. And that's why the answer is B for this one. Something like this will definitely be on the exam. Other things to note is you notice under anesthesia on codes 00700 or 00800. Thank you for becoming a member of the YouTube club. Thank you, thank you, thank you. Hopefully that access to all those bonus videos is super helpful. What if they tell you that the anesthesia was for their spleen or for their cecum? Would you know which body part is in the upper abdomen and which body part is in the lower abdomen? Knowing those differences can be really helpful, especially if you look at codes 00902. Do you know what body parts are under that green header? So that is really helpful. And where they like to trick you up on the CPC exam is giving you a body part, but then not telling you where it's kind of located. If you look at codes 00400 and 00500, do you know which body parts are in the thoracic area versus which ones are in the intrathoracic area? That's where they like to trip you up at. They'll give you a vague term, and you got to know which section you would be under as far as those green headers go. E&M, oh boy. Hey, Becky, good to see you. What do you guys think is the answer for this one? Where would an acute, uncomplicated illness or injury go? And probably using your chart on pages 9 and 10 is what they're wanting you to do right here. Nice. Thanks for the follow. Indeed. Let's see. Low is correct. Good job. All right. What about this patient? What header are we going to be under? Are we under inpatient consultation, office consultation, observation, or new patient? You take yours on the 29th, your 4th time. You got it, June. What do you guys think? PCP transfers the patient to cardiology. What does that mean? Who is billing? What subcategory is the cardiologist going to bill now? Yep, D, new patient. Good job, guys. All right, what about this one? Don't forget to utilize this chart on page 9 and 10 for this one. Taking your CPC exam in January. Yes, the boot camp would be great for that. Absolutely. 100%. They will put a freeze on the exam starting around January something where you can't book any more until like January 20th or something, but it's okay. But just so you know. Careful. You have what? An order for an MRI. We have previous results being looked at. We discussed with another primary care physician about the patient's condition. We did a lot of crap. Don't be afraid of it. There you go, lifestyle. Yes, don't be afraid. We do get to bill extensive for this one. Yes. If we did it, you can bill it. Too much reviews. Yep. All right, what about this one? There you go. Insulin, yes. So we're going to build D, high. I don't think anybody got that one. Yep. Yep. Don't be afraid of these. I know it's unusual that I share questions where we're going to bill extensive or high, but if it is there, you did do it, right? IV means that you are testing or giving drug therapy that requires intensive monitoring for toxicity. IV morphine, IV insulin, IV chemotherapy, those are all examples of high risk. Yes. Insulin is scary. You will see any nurse, even seasoned nurses, quake in their boots when they are given orders to give insulin. Quickest way you can kill somebody, and you can't get them back. You mess that up, the dosage, there's there's no getting it. You can't reverse it. So fast enough to save somebody. So, yeah. All right. We got modifiers that can help you get down to a 50-50 shot, right? Would we use an XS or would we use a 59 modifier for a situation like this? We do have a Medicare patient. Great miracle. No worries. Practice as many practice questions that you can between now and the 31st. As many as you can find. You guys know I love Pocket Prep. It taught me a lot, especially since it has the page numbers where you can find the answers at inside the manuals, which is super helpful for a CPT. It's great. You can use the link on my website. It'll save you some money. And also, they send me a little bit of money too when you use that link. And then I just use it to give you guys free YouTube memberships. Speaking of that, let's give out some more. You guys are in here. I like to give out 10 on for Christmas instead of just 5. All right, here we go. Let's give out 5 more. Alicia, Sandra, Little Cat, Kristen, and New Beginnings. Yay! You all just won a month's access of my YouTube membership. And you've even got, don't forget about the duck classes. Oh my God. Those are really good too. I do classes of the worst questions. They're usually about 2 hours long. I'm back. I'm back. Give me just a second, guys. Sorry about that. Sometimes my computer likes to toss cookies. Hasn't done it in a while, and I did reboot today before we started, but I was expecting a lot out of it. Let's see. Where were we? What question was I doing? I was E&M, right? What question was I doing? I was just giving away some memberships. We were doing E&M. Did anesthesia. We did that one. Fix you guys on TikTok. I think we did this one for the new patient. We did this one for the extensive data. And then we did this one for the insulin that was high. All right. And then we were talking about this Medicare patient. And then I decided to give away some YouTube memberships. I got to open back up chat because I lost it. on YouTube. So let me get that back open. Hopefully it finished giving out all the winners. About chat. Did it give out all 5? Yeah, it did. Good. Good, good, good. And then all right, I got live chat back up again on YouTube. All right. No worries, Janelle. Don't worry, the replay will be up for you guys. All right, this question, we're going to be utilizing our 59 modifier to go along with it. What code must be appended with modifier if the doctor utilized and removed a polyp utilizing the snare technique for a Medicare patient during their screening, right? We would be utilizing B is our answer. All the goats in the house. Hey, Tiffany, how's it going? Good to see you. I miss chatting with you. We've both been really busy. I had a kid that came up really sick and had to have hospitalization and surgery and stuff. So I've been like scatterbrained, and she's been restructuring everything. So, and working so hard. I love seeing all her Facebook posts every morning. Good to see you. This is just my little Christmas gift to everybody is trying to do 75 questions in 3 hours with them today. It's a little free workshop, seeing if they can handle doing questions about 120 seconds per question. What I like to do in these questions is count, right? If answer A is correct, we did 3 things that need to be billed, right? If we did answer B, it's just 2. It's answer C, it's just 1, so forth, right? So I count things. It's just how my brain works. So what did we do today? We did Prevnar, right? What else did we do? Think about those things. Hey, Queen. Oh, your brain is fried. Your reception is so bad. I'm sorry, Lifestyles. Don't forget, you can scroll over. The arrow button at the bottom also has a button to settings where you can change your screen settings to where the replay is a little bit better viewing. But also, if you're on the tube of the U, the play is direct from my computer to your computer. And then you can see the chat and my books and my notes too, all on one screen if you happen to be over on that device. But hey, Sam, you did not pass your exam yesterday. Oh my God, I'm so proud of you. We have worked so hard for that. Congratulations. That 8-hour boot camp is really awesome, right? I love it. That is so, but you have worked harder than anybody else in a long time to pass this certification exam. I am so proud of you, Sam. That just lifts a lot of weight off my heart, and I know yours too, but I'm so happy you passed. Congratulations. I am so proud of you. That's awesome. That is a great, great Christmas present right there. I start school for coding in the spring. What's the biggest tip you give someone who's new to coding? They're going to throw a bunch of ICD-10 coding and a lot of busy work at you. Um, and it's going to be overwhelming. Remember, you only have 5 questions on your certification exam for ICD-10, okay? Don't stress over ICD-10 so much. Number one thing, just just go with it and do what is required and move on. Don't stress, okay? Only 5 questions on the exam. Out of 100, only 5 are going to be ICD-10. Don't stress too much. Um, don't take it all to heart. Trust the process and really focus on the instructions in the front of these manuals on how the book is set up, why they have indentions somewhere, why they have parentheses somewhere, why there's a semicolon, why there's not a semicolon. How is the book set up and how to use it? If you learn how to navigate it like it's a map, then it doesn't matter what question is thrown at you, you can answer any question. So just knowing how to use the book is the most important and easiest thing to really learn if you go in and learn how to use the book. Maybe not, not learning how to code, or I don't know if that makes any sense, but really understanding. They have it in every single one of these books. At the very, very beginning, it'll say the instructions for how to use the CPT, instructions for how to use the ICD-10 book. Same thing for hip picks. Really go find examples. What are they talking about? What's an add-on code? What's a guideline? Where are they located? What are modifiers? What do they look like? What's an unlisted procedure? What does it look like in the back of the book when you find an unlisted procedure or an add-on code or procedure code or a mama code? What does the time mean in the guideline versus time for E&M, which is different. The CPT codes, the surgery codes have a different guideline for time than E&M does. So knowing why they set the book up the way it is, how it's formatted, and what that format means to you will help you more than anything on the exam. Like some of these questions that I have made up for you today about which codes can actually just have a modifier or which ones can you times 2. Knowing that information just by looking at a code, even without any notes, and knowing that this one you times, this one you don't, this one you add a modifier to it, that's more helpful than anything because it doesn't matter what they throw at you if you understand the formatting of the book. That makes a big difference. Place of service, how that affects it, all that kind of stuff. That's the best advice is learn how to use these books. Did anybody get the answer to this one? You were born on December 23rd. Oh, this one's A. We did all 3 things, right? We did the visit in a patient's home because they could not ambulate or get to a doctor's office. We actually went to their home and gave them the vaccine. and then we gave them the 2 vaccines, so you get to bill for all 3. You missed the home visit? Yeah, they get paid for driving to their house, yeah. Alright, let me move this camera thing out of the way. This one I didn't have time to type it out for you guys. I just screenshot it and put it right here, so sorry, it's gonna look weird. I only did this to 2 questions, but it's not gonna be like it makes it kinda look fuzzy, so sorry about that. E&M is a little crazy. Or it depends on which certification exam you're doing. If you're utilizing AAPC certifications, you can use the 2025 books till December 31st, 2026. If you're doing AHEMA certifications, you can use the 2025 books till April 1st, 2026. Straightforward. Are you seeing what I'm seeing? Who's answering A? Who's saying it's low, too? Miracle? You get to count each test as unique. So if you ordered a CBC, an iron level, a B12, and a folic, that's 1, 2, 3, 4. What does your chart on page 9 and 10 say? That if you ordered 3 or more, this is 1 out of 3, this is 2 out of 3. There you go. All right, this one's the last fuzzy one. Sorry, it's fuzzy. Let me see if I can make it smaller. The rest of them I typed. The last one answer was C, moderate. What about this one? What did we do today? We saw the patient in the office. So we know we're going to bill an office visit, right? We also saw the patient in the hospital. And we did appropriate history and exams in both settings. So we get to bill both. Yep. And we have to have that 25 modifier on there for our second visit. Yep. All right. Remember, I don't do the process of elimination with these. I just look at the available answers. Think about what I will see in my exam question if this is the answer. Like if A is the answer, all we did was an ER visit. If we did answer B, we did critical care for a patient, and so forth. So think about those, what you will see in the exam question. What do you guys think is correct? See you later, Nicole. Our last sentence said our total time for critical care was 25 minutes. And I know because of page 29 in our AMA CPT book, right, that our chart that we use for critical care right here says less than 30 minutes, use an appropriate E&M visit. So I know I can't use anything with critical care in it because I did not meet the qualifications for it because of time. So I know my only answer it could be is A. If it's answer A for this question, we did a discharge. If it's answer B, we did an admit. If it's answer C or D, we did subsequent hospital visits. If you don't know these codes by sight, then I highly recommend you guys get my flashcards. I have them free on my website underneath the resources tab. Go to the free practice area and you've got free E&M guideline flashcards that you do interactively on the internet on my website. Or you can, of course, go to the More tab and go to the store and purchase for $10 the E&M flashcards that you can print out and you can carry around with you as paper flashcards. But learn the headers of a few of these E&M codes, especially your hospitalizations, your consultations, your critical cares, and NICUs. That is super helpful. It'll give you a lot more flexibility and time when doing these E&M questions. What does our last sentence say? What are we doing? Who are we coding for? Don't assume. Always verify what they're asking you to code in certain questions. Thank you for the roses, Lifestyle. You do run into a little bit of a dilemma with this one. We don't have time with this one, but we have to make a decision whether we're moderate or high. We did review some stuff that was ordered yesterday, so we cannot count that as today's part of MDM, right? Because we only count it on the day it was ordered. So we have no elevation in our level of visit. So, yeah, we'll just keep our D for our subsequent hospital visit. OB, lab. I see we got that 51 listed in 3 of our answers. So I'd probably run there and see what's going on in that code first. I like doing CPT more than I do diagnosis codes, but that's just me. Whatever is you're more comfortable with. If we did 51, then we only had 3 specimens. How many specimens did we have altogether? And would we use the add-on code, which is the 52? 50 is just 1 dose. And we did have 3-hour tolerance test. So they have a lot of propaganda up here talking about her single test she had previously on a previous date. Today she was brought back for 3. Yeah. No, you don't have to memorize the codes at all. It's an open book exam. Everybody got B as your answer? Good job. Perfect. Yeah. We know we can't be D because that would have done more than 3-hour test. Yep. I see the 20 listed twice, and so is the 12. It's listed twice. Mm. So it's the 60, but then it's wanting to know, do we know, would RT or 50 modifier go with these codes? That could help us eliminate a lot of answers. Knowing what codes can go with which ones is really handy. Let's go to 60, 62. What kind of codes are these? What's going on in this set? 60 to 20. What's going on in these? Ooh, these are pink. They're pink highlighted in my book. That means they show up often on the exam. If it's A, we removed a thyroid. If it's, I'm sorry, if it's A, it's a lobe, not a thyroid. If it's 40, we removed a thyroid. If it's 60, we removed a thyroid. What did we remove? We removed a thyroid, not the lobe, which is the 20. So you can get rid of anything with the 20 in it, right? So we can get rid of A and D. So out of B and C, right, did we do a 40 or a 60? Did this patient have a previous removal? That's all. The only difference. And you do see the word previous from years ago. So you don't need to stick around and verify that you did the second code, since you eliminated the lobes not being removed, right? You got rid of A and D. Then your only difference is the first code, right? And 40, no previous history. 60 is previous history. Easy peasy, pick C and move on with your day. Don't stick around verifying that the correct answer is correct. If you've eliminated the other answers, keep them eliminated and move on. 505, 45 versus a 48. I see we've got 2 answers that are here and 2 answers that are here. I would see what my differences are between those 2 codes, right? 505. $505.45 is a child code. You can't do nothing with it. Where's its mama? That's the 41 code. 41 code, right, is a scope. What's our 48? Child code also. Both are radical. That with adrenal, then would you add another code to it or not? I don't see any urethra removed, so I would keep the 45s, sorry. And then it's just knowing whether you would add that 606 to it or not. Is that a prostate or something else? 60650 is another scope and biopsy that's transabdominal, blah, blah, blah. If you were going to add this code to this code, what have you got to have with it? Because this is not an add-on code, right? You can't have those 2 together because they're both individual codes, right? Even though the other one's a child code, it's still can't be coding those 2 together without something with it. So yes, A is our answer. For sure. All right. We've got this 96 down a whole bunch of times. What's going on with it? 617. 61796. We got stereo. Is that what we did? Would we add anything to it? If we added any of these codes, do we need to have anything with it? Are they add-on codes that don't need any modifiers? Or are we done once we bill that code? A was the previous answer. This one is B. We did do the head frame. So if we did the radiosurgery and we did the head frame, we do get to add B, but you can see by looking at the code 61800, you see how it has the plus symbol in front of it? That means you can add it to another procedure and no modifier is needed. And you can code those two together. Perfect. Yep. What do I see here when I look at these answers, right? I see same diagnosis codes, same procedure twice, just a difference between modifiers. Do we normally stop procedures in this area? A 52 modifier is so unlikely. Unless we stop something. Right and left on eye surgeries, that's more likely, right? So if I was a gambling woman, I would just pick D as my answer and move on to my next question. Just by looking for similarities and looking at my modifier differences. Here's our second page of this example. Let me move my camera thingy out of the way for you guys. If I do go look at the 66170, 6666, gotta go this way. The child coach can't do nothing with it. You gotta go find its mama. Its mama is 66150, which is dealing with the glaucoma, right? And we are doing the trab. Mm-hmm. And yeah, what would you need on this one is a right and left for the eye. Definite D. 61800 is an add-on code. I see that we have 3 of them with the 93 code in it. What did we do? We did bilateral. And a lot of times our answer, right, for this one, right is 1, left is 2. Bilateral often can be the number 3. So I do love the answers with 3 in it. So that would make me want to get rid of B. And then it's just deciding, out of these, looking for my similarities. We've got 2 of them with the 36. Would we use the 50 bilateral modifier with the procedures? And probably would, right? The 2 similars are the 3 sixes, and then add my bilateral code to it, giving me answer A. If you're a gambling girl, you can pick A and move on to your next question. If you want to know if you're a 33 or a 36, you can go to 694 36. And then you're 33. One of them's wanting to know if you're using general anesthesia or not. So, you didn't just numb up the area, so you cannot use C because the anesthesia differences. And since you did bilateral, you do have to use your modifier. Yep, A is still correct. What do you guys think here? Do you know your code headers without having to look them up? That's standby services and discharge. What do you guys think on TikTok? Thank you for the 5,000 tappy taps. Thank you for the 30 roses. I don't think anybody's going to get this one right, but if we look at our available answers, our 99463 is our combo code. It includes an admit and discharge all in the same day for delivery. It is how I delivered my kid. So John was born at noon, and I was discharged home by 6 p.m. that night. You have a combo code for us extremely blessed mamas who just have to come in just for a short time and we can go home and go do laundry or empty the dishwasher. We don't have to stay overnight. So there's a few of us, and they do have a combo code for that situation. It's not just observation that can be admit and discharge. You can do a birthing center or admit hospital and discharge for neonates. That's a combo code too. All right. What did we do for this one? Did we do something where we get to bill for 3 items? Or are we billing for 2 procedures? Are we billing for 1 office visit and 1 HCPCS code or 2 procedures? What are we doing? This one's like 1 office visit and 2 procedures. So technically, office visit and then 2 procedures, but 3 things altogether. I think about those differences when I'm looking at the answers, and then I only investigate what I need out of the question to make those answers correct, right? If I did an office visit, then I need a face-to-face meeting with the physician. I need a history taken. I need an examination of their ear, nose, throat, and bowel sounds done. I need a medical decision made about their healthcare system. If I did not do those things, then I cannot bill an office visit, right? If I'm billing for vaccines, then I'm billing for 71. If I'm billing for immunoglobulin, I could be billing like a 72. Knowing the differences between those is vital for the exam. Well, it's for one question. You get one question on vaccines, maybe on your exam. Not everybody gets the vaccine question, but knowing the difference between vaccines or immunoglobulins is helpful for sure. Because you might get like the rabies. There's one immunoglobulin that you get for the day you get bit by an animal, right? You're going to try to prevent the rabies. But then you could get rabies shots for to build up their immunity. So there's 2 different sets. Know whether you're giving a vaccine or immunoglobulins. Okay. Do I, you know, I like to stay away from nines as far as diagnosis codes. So that would make me hyper focus on B's and C's just because not diagnosis codes that end in 9 are usually non-specified, like non-specific. And she's pregnant, and I mean that's pretty specific, like if she has twins or triplets or delivers or miscarriages, that's still pretty specific. It's not just a generic, they're here for an ankle fracture, but oh, by the way, they're pregnant. I don't know. I usually just avoid the nines. Um, and then it's just a difference. Am I a 20 or a 12? Did I do 2 things or did I do 1 thing to the patient? Thinking about that can be helpful too. If I was to do these 2 procedures together with no modifier, would that happen? Can that happen? Maybe just knowing what type of codes they are is helpful. And you can see that the 595 or 59424, some of them can be add-on codes. Happy holidays, June. How you doing? Sometimes just knowing that the first 2 digits in the diagnosis code, right? C5 means it's primary cancer. Sometimes knowing that C7, 8, and 9 means that it's metastatic cancer. Just knowing little tricks like that, you can look through the question and see if there's any mention of, metastatic cancer. That can help you eliminate some of the answers right away. If you don't see anything with metastatic cancer, you can get rid of the C7s, right? And then that helps you just know that you're either a 40 or a 43. We can go look at our differences, 8, 9, 40, and 43. One of them is for malignancy. She's being assessed, but we don't have any pathology back. Yep. Indeed, A is your answer. Perfect. And just knowing that the diagnosis codes alone in every single answer, no matter what you pick, all are dealing with cancer. And then your differences between your procedures is cancer or no cancer. I mean, that's all. It's like a general overview. Do you know these codes deal with cancer? Well, every single answer deals with cancer. This CPT code is no cancer. That wouldn't go with this diagnose code. Just in general overview of things like that is helpful to practice and notice. In our anesthesia section, hopefully you've moved over your anesthesia modifiers. If you haven't yet, they're inside your HCPCS book. If you happen to have AAPC's version, your anesthesia modifiers are in the back of the HCPCS book, in the back cover of your book, the very, very back cover. So that's just if you happen to have AAPC's version. The very back cover has your anesthesia modifiers. They won't be included in your CPT book. Everything from AA to QZ, I moved to my CPT book in the anesthesia section for these questions. Sorry, guys. I see that 3 of my answers have AA in it. And if that's happening, then the anesthesiologist did the anesthesia themselves. And if that didn't happen, then I know my answer's B right away. That's kind of helpful. But I'll just look at the bottom of the question and look to see who I'm billing for. So if the anesthesiologist did the anesthesia themselves, then I know I just need to get rid of B. Was my patient super sick? Were they a P5? Physical status level Down syndrome patient. And not expected to survive. Aw, that is a pretty sick patient. So noticing that P5 is helpful, that A does not have that in it. Avoid my 9s. That helps me usually. So that gets me down to just C, right? Because usually those are just generic diagnose codes. C is the answer. Have I wore everybody out yet? All right, look at this one. More modifiers. Look, would we use an RT in this area? No modifiers at all, or a 47 modifier? What's going on with these 647 code? 647. These are nerve ones on the wrist. And you know you have a right and a left on the wrist, right? So if you're doing a surgery on a wrist in this area, you will need an RT. So I would get rid of D because it's throwing anesthesia in on a procedure anyway. So that looks weird. Are we doing a 19, a 21, or a 22? Depends on the bone, right? Are we doing wrist, elbow, or cranial? Something like that. Or medial carpal tunnel. And we're doing carpal tunnel. Yeah, so you know your answer has to be C with the carpal tunnel because 22 is just to decompress a non-specific nerve. And then 19 is for your ulna nerve in the wrist. So yeah, definitely C. Yeah, sorry, go-kart, but if you read P5 in your anesthesia, it says that the patient is not expected to survive. It says it in that P5 section right there. P5, a whatever patient who is not expected to survive without an operation. So anybody who's not expected to survive will be a P5. Others with diseases that threat their life are P4. And then patients that are declared dead are P6s. Ooh, look at all these modifiers. Do you know your differences between 52, 54, 55, and 56? Oh my. Let's go look at the front cover and see what those are. So 52 is reduced services. We rarely do that on patients. So I'd be skeptical about that. 54 is surgical care only. 55 is postoperative management. And 56 is preoperative management. Who did what? Surgeon did one thing, PCP did another. What do you guys think? It's a cool question. David, happy holidays. Merry Christmas to you too. Hope this is super helpful for you. It's a really cool question. First thing I notice is 2 answers have the same code listed for 2 different doctors, and then C and D have different procedures listed for different doctors. And if that happened, we wouldn't need, I don't know. It doesn't seem like it would be the point of any of these questions. But I mean, the PCP didn't do any procedure on the patient. They only did the pre-op visit for a procedure for the surgeon, right? So it wouldn't be a different procedure because the PCP didn't do a different procedure. All they did was the pre-op visit. Anyway, this makes no sense to me. I wouldn't even consider those 2. And then out of these 2, what would I need, right? Surgical care only, preoperative and postoperative only. Yeah, looks good to me. I like B. Yeah. All right. Are we in the ER? Are we in critical care? Subsequent hospital visit and something else? Or critical care? Probably 2 pages. Yeah. Here's the other page. Determine the correct E&M for the ER physician in this scenario. We transferred the patient to ICU. The choices again are ER visit, critical care, subsequent hospital visit, and maybe a management code like staff doing some sort of consolidation of care, or critical care. and we transferred them to ICU. From the ER. So on our page 29, to be able to bill critical care, we need at least 30 minutes. We had 60 minutes of critical care time. So if you look at your chart and you put 60 minutes in, it tells you what the answer is, which is D. We do get to bill it because we were actively trying to keep them alive, right? Microscope is often on the exam. That is our 999 code. And then knowing whether you can code the microscope with other codes will be on the exam for sure. I have them marked in my notes to say whether you can add it or not. They do have a bunch of them listed for do nots, but they don't list the ones that you can use it. So that's really helpful in this area. But if you pay attention to your descriptors, you'll be able to get this one. Three of our answers are the 61700 code. Only one of them is the 03. One of them is just different, like approach, which is cervical approach, which we didn't do. So you know you can get rid of the 03 because your approach was not cervical. Your approach was intracranial, which is included in your 000. Now you just need to know, would I add a microscope to it? This is an add-on code, so you know you would never add a modifier to it. So it couldn't be B. But knowing whether your answer is A or C is the whole thing. If you didn't know whether your microscope could be included or not, think about like their diagnosis then, because right here we've got one diagnosis. Here we have three diagnoses. Does this patient have three diagnoses or do they have one diagnosis? That might be able to help you out too. Sometimes when you don't have enough to give you on one thing, it might be able to help you out on another thing. But you just got to be able to have a plan of attack that's fast. If you run into a wall, you got to know, oh, I can go look here and do something different. being able to transition in the middle of your question when you were looking for a particular answer and you might not know it. When you hit that wall, being able to transition and find something different is helpful. This patient did have 3 diagnoses, so that kind of helped too. And we can use Microscope on those codes. We have 3 answers that are under the 623. When you have different second and third digits, a lot of times they're under different procedures or surgeries. And eliminating that is usually pretty easy. And I just use this chart at the beginning of the chapters. If I look at the 6444 area, then we would be doing somatic nerves. If we're doing 623 nerves, we're doing spine and spinal cord, right? We have 2 similarities, which is just our 220s, and then just knowing whether radiology is included in it or not is helpful. If we were going to bill radiology guidance, we have a code for it, which would be our 21 code. 62321 includes radiology. That means we would never utilize anything from radiology in this area because we have a code for needle guidance if we needed it. So just knowing that little tidbit will direct you towards the correct answer, which is C. Don't forget about your functions of the book, whether it's ICD-10, CPT, or HCPCS. They want to know if you know how the book is set up, right? What does it mean when they say not coded here? Is that an excludes 1, excludes 2? Does that mean it includes or it needs or it's too educated and we need more? We don't have a code for it, right? In EC, what do you guys think? Yep, excludes 1, not coded here. Wordy ones, be careful. All of them start off with modifier information. 2 of them have no modifier. One of them has modifier 63 noted in the answer. What would you do for this question with all these words? And, time's ticking. 44120 is the code that they're talking about. which is a mama code in the intestines. If we were doing a bowel resection on this one, what would we do? Do we need a modifier? Thank you for the 52 roses. Mm. So our 63 modifier on the side bar of your CPT book, remember the front cover? Procedures performed on infants less than 4 kilograms. B is correct. What about this wordy modifier one? We're dealing with 76 or 59. 76 is repeat procedure and 59 is a distinct procedure service. What would happen with this one? You're welcome. Bernice, good to see you. We just have just a tiny few left. I think we got 10 more left and then we're done. What do you guys think for this one? I test tomorrow. I'll take the day off, but I'm here. Oh, awesome. Best of luck to you. Yeah, the patients stabbed themselves and collapsed their lung. And then the doctor reinflated the lung. But later on, the patient pulled out the tube and deflated their lung again. And then the doctor had to reinsert the chest tube in a different incision, right? So, new incision. And I should not be reading the question to you because that you're not going to have anybody there to read you the questions during your exam. So, you got to be able to pull the important information out of these questions without reading them. But in evaluating, if answer A is correct, is that what we do? If answer B is correct, what would we do? Keep me informed. I got to know how you do tomorrow. Email me. You just joined your subscription. Awesome. Um, this is my free Christmas gift for you guys is the workshop. So today is the free workshop where we do 75 questions all in one live. We've done 65 questions so far today. My next live is already posted. It's going to be the 29th. So Monday the 29th will be our next one. We'll do 2 hours of free live lesson then. Just because I still got to go do Christmas shopping and stuff like that for this week. And we're 2 days away from Christmas Eve and stuff. And my house is a wreck. And we got Aunt Shy and Uncle Chris coming over. So I got to do mom things for the next couple of days. But I hope you guys have a stress-free holiday. I hope pennies from heaven come down and support your family. I got a check in the mail from one of the casinos in Vegas. I guess they had a breach in whatever and sold my data, whatever. I got a $50 check this week. I'm like, ooh, pennies from heaven, you know? It's like, that'll pay for the Christmas ham. So, it's always nice to have little things show up for some reason. I don't ever remember signing up for that or whatever, but it's nice when it just kind of lands in your lap for no reason. So that's nice. I hope you guys get a check in the mail for no reason too. That's legit, It's awesome. It'll be 4:30 Arizona time zone. It's already on the tube of the U. So if you go to that channel, same name, Medical Coding by Jen, it's already listed and you can just click on the notify me link and it'll alert your phone when I go live, but it'll be 4:30 Arizona time zone. Right now it is 2:51 here. We do not follow along with the daylight savings time either. So part of the year it's one time and then part of the year it's a different time, but we never change our time. You guys change. So it's kind of weird. But I wish nobody followed that daylight savings time. We don't have to get up and farm the crops anymore, so we don't need to switch the times about. Everybody got B for this one? Close, close. B. 76 should be reported for the second procedure. No modifier is needed for the first procedure. All right, what appendix would a neurologist consult when trying to pick out the correct answer for which motor nerve they might be working on? Yes, pennies from heaven. I test on Tuesday. I definitely hope you pass. So you have no more exam attempts for sure. Are you sure about that? Go kart. We're not talking about arteries and veins. Arteries and veins are in Appendix L. Good job, Tamara. We are Appendix J for nerves. Yes, don't assume. A lot of people assume answers, so be very, very careful that they haven't switched up the exam question on you. For malignant lesions, if we removed a malignant lesion and it resulted in a skin defect and it was closed with a Z-plasty, what would be reported? Do we code for the Z-plasty only? Do we code for the malignant lesion and the Z-plasty? Do we code for the malignant lesion only? Or do a complex repair? What do you guys think? Come on, TikTok. There's 28 of you guys on. What would we be doing? Yes, pennies from heaven. Wish that for all of you guys. A is the answer. We'll do the Z plasty only. Ooh. All right. What about this one? Don't forget about your definitions to words. A lot of your definitions are inside your CPT book. It's like a mini little dictionary. It has lots of definitions in it. You'd be surprised. But if a pulmonologist performed a diagnostic bronchoscope with biopsy, and we used a proliferate on the bronchial walls, and we submitted tissues to a pathologist, what are we billing? Did we do transbronchial? Did we do bronchial? Did we do bronchial alveolar? Or did we do some sort of specimen brushing? What would these words have you coding? This one drives me crazy with the course too, because what's listed in the back of the book and the index is different than what's in the CPT code and the descriptor versus what's in the clinical note in our exam question area. They all have different names. Crazy. Hey, MK. Good to see you, love. Happy holidays. Thank you guys for sharing the live and all the tappy taps. Good to see you guys. Yeah, but you wouldn't call, like, that's not what you would call, like, just what's another word for this? What is this? Where did we go? We took the scope and we went through the bronchial area, right down to the lung. Yeah, so it's just A. It's just the route in to the lung is all they were asking about. It make it look a lot harder than it is. Like with these catheterizations, knowing whether you're non-selective, selective, manipulative, or radical. You ever heard of catheters being called this? I've heard of broken bones or lymph node removals, but not really catheterizations. So it's probably just a difference between these two. But still, knowing the differences between these two definitions, everybody confuses. So if you've got this word and that word, what does that mean you did? Don't think of it too hard. Yes, we are selecting. We are manipulating. We are selecting. Yes, perfect. Don't forget, if you've got a chart in your book, Please utilize it for the exam. So there's this tiny, tiny little chart on page 550. Please learn how to use it. It will tell you what the answer is. That's all they're doing with this exam question, is seeing if you know how to use that chart. $550. The bottom of the first column. Tiny little chart. So if you're doing abdomen, you're on the third column over, and you're going to go down and meet it to the pelvis. And you did both of them without contrast. So your answer is the first line down under pelvis, but under abdomen. And your answer is lab and path. These colorectal guaiac cards are the worst, but they will be asked on your certification exam, 100%. So you got to know your differences. Which answer is correct for this one? Some of them, they do them in the office and the physician does them. Some of them, the patients take home. Some of them are read by a stain. Some of them are, they use like hydrogen peroxide. It depends on how they're reading them, how the results will come back. If it's instant, if it's mail back in. And if all else fails, I just bill the cheapest code, the one with the smallest number. Because a lot of times that just ends up being the correct answer. Because they're trying to get you to bill something that's more expensive than it really is. So sometimes I just do that. And that helps. Prostate, if we're doing antagonist therapy, the two codes that are the closest together are the O1 and the O2. So I would run to those two and see what the differences are. 964. O1 and O2. Ooh, these codes will be on the exam. Which one is for hormonal? Yep, hormone is O2. O1 is non-hormonal. O5 is interlesional. 13 is something totally different. Yep. All right, 51 is down twice, and they want to know if we can add a 55 to it. Probably not. I'd probably just pick D and move on to my next question. That's what I would do. I wouldn't read none of this because it's going to be confusing, I'm sure. 934, 51. Right side of the heart catheterization. Okay. And then 55 is a child code of 54. And we would not build those two together without a modifier. There's no way. 51 is right side of the heart. Yep. And we did the right side of the heart. So I would stick with D. D is correct. Duodenum resection due to cancer. If it's got carcinoma in it, it's an 09, isn't it? 100%. If it's just for a tumor that's not cancer, it'll be an 07. If it's for gallbladder or H. pylori, it'll be an 05. But you see that word carcinoma, it'll be an 09. If you see brain or craniotomy, it's an 07. Yep. Yep. All right. Have we got a Medicare patient? Why do we have a CW? Oh, for the CLIA waiver? Okay. So CW, are we an 07 or an 05? What did we remove? A colon polyp? We doing for H. pylori or malignancy? Oh, okay. What did it come back as? So it's got to be an 05. It's just a polyp. It's not a tumor and it's not carcinoma. So I like B. B is correct. Yay. Those are just word searches for those. Don't let this one scare you. Take it one thing at a time. Are you an 09? And if you are an 09, would you times it by 2? Or would you not times it? That'll get you a correct answer. We have a guideline in the very beginning of these codes, right at the 88300 code. Right before it, it says if they're in separate containers, then you can times it. So if everything was placed in one container, then you can't times it. So you get rid of everything that has any timesing in it. The 05 has a times in it. The 09s have times in it. The only answer that does not have a times in it is B. If you have separate containers, then you can times it. B. Autopsy. Stillburn. We did gross and microscope. Microscopes means that you did anything above the 88 something. I don't know those off the top of my head. 88. Oh. Yeah. With microscope, it starts at the 20. So anything with 20 and above could be with microscope. So we know 14 is out the door. 99's unspecified. That ain't going nowhere with the nines. So are we a 29 or a 40? 29 and then the 40 is forensic. Do we have probably nothing? Nothing we have to go to court for. So it's got to be the 29. Got to be B. B is correct. We're testing for chloride. Can be found in both basic metabolic panels. Which other panels also include chloride? Ooh, so we just go to our very front of our lab and path codes where our lovely little panels are at with the 000s. Second and third digits have the zeros in them. They're on page 16 and 17. Which ones have chloride in it? Lipid is down twice. That's the 61. So I'd work on eliminating that or keeping it. And because that's in two of them. And I can see that fastest. And I don't see a chloride in it. So that would help me eliminate those two really fast. And then now I just need to know, is it in a renal or general health? Because it's in the electrolyte, obviously, because it's in 3 of the answers. Renal has chloride in it. It does. 82435. So B. Has to be B. Yes, B is the answer. All right. What 3 different panels all have carbon dioxide, calcium, and sodium in them? "48" is in 3 of the answers. So it must be that one. Then it's just a difference between 51 and 53. It says 3 different panels. A only has 2 panels, so it can't be A. Those 2 are the same for those 2 answers. Then it's just a difference. 53 is in that one. It's also in that one. The only difference is 69. Yep, it must be C. Yes. Female confirmation pregnancy test with her OB panel. Our OB panel is the 55, which includes our CBC, our white count, our syphilis. It includes all that stuff. So we'll definitely have our 55. We just need to know which urine test is for our urine pregnancy. And I have that one written down in my notes next to my OB panel. That way I don't have to move it or go look up the urine pregnancies because it's a pain. But it's also the code that's in our throwaway one that's similar. So if you look for your similarities, but you know you have to throw away this one because it's way too long, too many codes, you'll know that your answer is B without looking around. If you have my notes in this area also, you know that C and D cannot be correct because you cannot times these codes. Even when you repeat the drug screens, you don't bill these again. The only difference between the '05 and the '07 is whether you used a dipstick or not. We used a chemistry analyzer machine and not a dipstick. So we know our answer has to be A because it's the only one in this area that does not use a dipstick. It uses a machine. On the exam, they'll say something like TCL or TLC or something, and they won't say this word. And they won't say dipstick either. So if you know that the acronym for this machine is also called this, you'll know that '07 is the answer also. Just a couple of more anatomy ones. Throw you guys off. What do you guys think is the answer for this one? Hey, Pennywise, how's it going? For the course for AAPC, I just charge you guys exactly what AAPC charges me. And in fact, with the credit card fees and the fees for my website to collect money from you guys, I lose money every time I sell a course. So, because AAPC sells me, or I have to buy the books, they charge me a credit card fee, they charge me tax, they charge me shipping, all that stuff adds up. So the course is just it's a loss for me anyway. So I don't have any promo codes for it. But it does come with all my notes, unlimited Zoom lessons with me for a year, and all the individual lessons that I teach for the course um, for a year. So, like, if you do a 16-week course with me, you get access for the year. But let's say you didn't attend all the 16 lessons or you want to do them again. Then when I restart the course again in 16 weeks, you can do the second set of 16 lessons with me. So you get me for a year. I'm fixing to restart the course again in January. I haven't picked the date yet when we're going to start, but we're going to do 2 lessons a week. I do all the practical applications with you guys and the practice exam questions to help you guys throughout the course. And you get Practicode, you get your books. You come out of the course with no apprenticeship because you took the course, and you do Practicode, and you'll have a full CPC. And you get all the replays of all the live lessons. You get all my workshops, boot camps, my notes, everything for a year. Whatever I create and make, it's all included. But I lose a lot of money on those courses because they charge me everything on those things. And I don't know whether I'm going to sign up again for next year. So this probably be my last time that I have the license, I guess. I don't know whether I'll renew in April. But they'll let me continue to teach for a year if you do purchase in January. Even if I don't renew my license, I'll still be your teacher for a year. I just won't sign up more students after that point, but I'm still responsible for that year for those students. That's good. I hate when people are too confident, then they usually don't pass. It's the ones who aren't confident who usually pass, and they're surprised. This question is always on the exam. Yep, it sure is. That's why I put it up here today. Everybody get this one right? All right. What about this anatomy one? This one has been on the exam recently too. The one before it was A, kidneys, right? This one, what do you guys think? This one's in your ICD-10 book. If you go to the endocrine section in the anatomy part, right before you start coding those ICD-10 codes, you'll find one tiny little mention of this hormone, and that is your thymus. It is C. All right, guys, I hope this was super helpful. We did over 80 questions. Um, the replay of this will be available on Tube of the U. It's already recorded, and you can go rewatch it anytime. You can pause the screen and do all the exam questions over again. Um, don't forget to do the little bit of homework that's right here on this page. Be sure you know how to do like hair transplants, or you know some of the definitions of some of these terms. You've looked over some of the codes here, um, looked over some of the procedures here, because these might be super helpful for you. Don't forget about that principal care management chart in the E&M section. That too will also be super helpful for any medical coding certification exam. Yes, yes, yes. Happy holidays. Happy holidays. I hope this is super helpful for you guys. And I wish nothing but the best for you guys. Keep me informed on your certification exam attempts and let me know how it goes. Email me at medicalcodingbyjen@gmail.com and let me know how you do on your certification exams. If there's anything you wish I had told you was going to be on there, I'd love to hear about it. Um, Even if you just tell me, this, and this, just like you said, was on there. Perfect. That's great. But I hope you guys have a great holiday. We'll be back on December the 29th for 2 more hours of free live lesson. And this Tuesday, the 23rd, is my final exam for my students in the current CPC course. So, you guys, I will see you on Tuesday for your guys' final exam. We'll be on Zoom. Happy holidays. Happy holidays. I hope this was super helpful. I love you guys so much, and I'm so proud of you guys. I hope this was helpful.